Let us get slowly started, maybe in 1 or 2 minutes as we get ready. Welcome, everyone. All right, let's get started. So welcome to this session on SSB taxes, specifically modeling how SSB taxes can impact behaviors, health costs, and also importantly, equity. We have 3 papers. My name is Stéphane Verguet. I am with the Harvard School of Public Health, and I will be chairing the session. And for this session, we have 3 papers and 3 discussants. And as everybody knows, the presentations have already been recorded. So the full papers, slides, documentations, and live recordings are already available on the IHEA website that everybody hopefully has seen ahead of this session. And what we will do is we will have 3 papers. Each paper will be succinctly summarized by each presenter, and then we'll have a little bit more time for some comments and remarks by 3 discussants, each 1 discussant per paper. And the way we're going to organize this is I'm hoping, and I think we will be efficient on time, I'm hoping we will get a good chunk of time for discussions, questions. So please do hold your questions along the presentations for the end. And we will come back to each of the papers so that we make sure that we have enough time to both have succinct summaries as well as the discussants' comments on each papers. Okay, all right, so keep your questions to be hand, and then I think it's probably manageable. I mean, I'll have a reminder in the Q&A session in the end to raise your hand or put your questions on the chat. So without further ado, let us get started. So our first speaker today is Richard Smith. So Richard is a professor of health economics and also deputy pro vice chancellor at the University of Exeter. He has a number of wide-ranging projects on the economics of food systems, calorie labeling, takeaway food, regulation of takeaway food outlets, etc., including obviously the topic of this paper today is work on SSB taxes on the macroeconomic impacts of a sugar tax, the case of the UK soft drinks industry levy. So Richard, the Zoom is yours. So please feel free to share your slides. I think it should be working.
I don't think I'll share any slides, Stefan, if that's all right. And I'll just talk for a few minutes and give a summary, because the slides are obviously, as you say, on the website. People can download and have a look whilst I'm talking if they haven't seen them. And as you said, the longer presentation's there. So I was just going to give a summary for a few minutes, if that's all right with you. So the presentation, as Stefan said, this is part of this evaluation of the UK version of sugar sweetened beverage tax, which is called the Sugar Drinks Industry Levy, the SDIL. And SDIL is a little bit different to many countries' sugar taxes, which are often on the retail price. So it's literally a tax at the end, which the consumer pays. SDIL is a bit different. It's a tax on producer or importer of the beverage itself. And the reasoning behind that is to encourage reformulation. So reducing sugar content rather than necessarily reducing consumption of the beverages that might contain the sugar. So if the levy works perfectly, there might not be any change in consumption of soft drinks, but those soft drinks will have low or no sugar in them. So we'll have reduced consumption of sugar, but not necessarily of the beverages, which becomes important a bit later on. I know JC is going to pick up on this in terms of the Mexico simulations that that he was doing. And there certainly seems to have been some success. If you look at the individual products, quite a bit of reformulation, and very early on, this tax was going to be hypothecated in the sense that the receipts of it were to be allocated towards the school sector and to children to encourage physical activity, for example. And very early on, government removed at least half in terms of their estimate of what tax receipts they'd get. So there's already very early indications this was going to be impacting on formulation. But food system's complex, as everyone on this Zoom call will know. So introducing SDIL, you never know quite what's going to happen. A bit like throwing a stone into a pond. There will be some ripples. We don't know how big or how far they'll go. We have reformulation, as I said, that might impact taste and preference, product substitution. We probably will have some price change. We might have new product development, possible impacts on employment. Certainly if you listen to the industry side, we'll have big impacts on employment. There might be impacts through the tax receipts going to different things like the school education, physical activity and so forth. So capturing all those kind of feedback and effects is really quite critical. So our approach into that was to look at this from a macroeconomic perspective, kind of downwards, rather than from the very micro and go upwards, using the computable general equilibrium model approach. So that's a fairly flexible approach to look at macroeconomy. We've used in a number of areas, but because it builds up from the micro. So it takes kind of the sectors of the economy are really the core building blocks, and we have some agents in there, your consumers, your producers, your government. And so it captures a lot of the interaction at that kind of sectoral level and the interlinkages. And we have built into that a demand system model, for example, which again is the sort of thing I think JC is going to talk about their approach in Mexico, which we use. We use the almost ideal demand system in the UK to build into that. So obviously in the presentation, I talk a bit more about kind of the modeling. In terms of results, there was quite a bit of reformulation, as I said, but not total. So there was some price change. So there was some reduction in purchase of sugar sweetened beverages, obviously particularly those in the higher tax band, but we had an increase in purchase of low or no sugar drinks, so those that were exempted from the tax. On balance, that translates into what seems to be certainly predicted, if not coming true, impacts on coronary heart disease and diabetes particularly. And again, I think there's close correlations there with some of the stuff JC is going to talk about. And just to put it in perspective, if you just look at the health impacts and nothing else and trace that through the macro model, that would give you, over the time period we looked at, a positive impact of around £5 billion. Unfortunately, we can't present the full results, but I think there's an interesting reason why we can't. Early indications when we looked at this very early on in terms of the process, we thought we were likely to have some impacts through in terms of employment, in terms of substitutions and various things. That was based on essentially quite a bit of pass-through, so not a lot of reformulation and quite a bit of pass-through. We have evidence obviously of higher pass-through, so there's lower price effects. But what was quite interesting to try to get to grips with is the product proliferation and differentiation that's been happening. So you have changes in size of products, you have new products which you come to market, you have an expansion of milk-based drinks which are exempted from the tax. You have lots of things happening. And to try to keep pace with that's been quite an interesting exercise. So that, I think, will be quite an interesting one to talk through how we manage that as a broader community who are trying to look at this. But the good news is we have 6 months to sort it out because we're due to finish by the end of Christmas. So we will produce some results. It's just we're hoping to do it by early on this year rather than early on next year, which is a shame for this conference, but never mind. So if I summarise overall, I'd say at the moment SDIL seems to be a success story and a win for everybody, which is interesting if it's true. It's reducing sugar consumed, not reducing the beverages purchased. So does it achieve the Holy Grail, achieves public health benefits without harming soft drinks companies or harming the economy? or indeed potentially impacting on the sort of regressive effects that sometimes we worry about. So that's a bit of a question. Is it actually doing that? Because that seems to be where it seems to be heading. But we're fascinated to hear from other experiences in trying to assess macro impacts, particularly, not just kind of the results, but also there are different ways of modeling this. So others that have done that would be great to hear about. I'm very happy to go into anything else in detail, Stefan, but that I think is the summary of where we are.
Excellent, and no, thanks a lot, Richard. Excellent and rich summary indeed. So let us get some remarks now from Arantxa Colchero on Richard's paper. So Arantxa is a health economist. She's currently an associate professor at Mexico's National Institute of Public Health. And she has major interests in several work on obesity, especially among women, has worked on design and impact evaluation and innovative strategies to prevent and reduce obesity, fiscal policies, and front of package labels in Mexico and also Chile. So I see perfect, Arantxa, you already have the slides up. Excellent. So the Zoom is all yours on some remarks from you on Richard's presentation. Please.
Yes, thank you, Stefan, and thank you, Richard, for the opportunity to discuss your paper, your work. So let me start with what beverages are covered by the tax. And I think this is all over the world. There are different taxes, different designs, and it's very interesting. So I understand that in the UK, it excludes meal-based drinks, pure fruit juices, and alcohol. And my question would be why? All of them have high sugar content. And what percent of total beverages do they represent? So in Mexico, for example, we exclude beverages with artificial sweeteners. I don't know if the UK excludes them or not. But I think, for example, France includes them in the tax. Alcohol, I think it's very interesting. It's not associated with obesity, but it's a big burden. Should we start thinking about alcohol? Mexico has taxes to alcohol, but it's an old tax. It has been evaluated. I think we need to think about increasing the tax and maybe thinking about a big package of Pigouvian taxes, right? Our tax excludes poor fruit juices because we have very few in the market, but they have a lot of sugar content. The idea that they are healthy, they're not. You have to eat the fruits, not to drink them. And in Mexico, the tax includes milk-based drinks with added sugar. That's something different. I think we are the only country with that. In terms of the tax design, and so it's a two-tiered levy, it's always a little bit difficult to understand how much this is in terms of percent change in price, for example. And I always think that, for example, are beverages less than 5 grams per 100 milliliters too high in sugar content for children? That's something that concerns me. And also about the message, is it that a little bit of sugar is fine for the population? And another question that I have, and this is because I have the example in Mexico about prices. Are there differences in prices by sugar content? Is it that those with high sugar content are less expensive or more expensive? Is that something that would affect the result? For example, in Mexico, we have a 1 peso per liter. We have a large variation in prices, and this tax, the volumetric tax, would reduce the gap in price, although it's relatively low to do that. And we actually have shown that people didn't switch to to cheaper prices beverages. About revenues and earmarking, I think this is a very interesting topic, and I see that in the UK, funds are raised to children's health initiatives, which is great. But in Mexico and in other countries, revenues cannot be earmarked. And I think earmarking Pigouvian taxes are key, because it increases population support. It could compensate for the poor if taxes are regressive. And this can generate investments on key areas. So how can we think more worldwide, and how can we influence countries and governments to earmark Pigouvian taxes? In Mexico, it's really, really difficult. They don't want to do that. And I understand that governments want to use their resources for priorities. I understand that, but maybe part of the taxes should be earmark to compensate so that and to increase support from the population. In terms of what taxes can achieve, of course we can expect increases in prices, and this is another very interesting topic. How much, and how much then if there's an increase in prices, then you would expect reductions in consumption, but the magnitude of the increases in prices are important. Of course, there are other ways that consumption can reduce, but really prices are key here. Can we expect reductions in calories? There's always this topic about substitutions to other food or beverages with added sugars. And I'm going to come to models. What do we assume for models? That there is substitution, that there's not enough information. It's so hard to evaluate the overall impact on calories and the impact on substitutions. The other thing, and you mentioned that, I think it's, of course, the industry overestimates the impacts on employment, but I think we need to show them that this is not the case, that they, for example, in Mexico, we evaluated the impact of the taxes on employment, and we found that there were no impacts because they produced the substitutes, and they produce water, and so at the end they didn't lose. But what do we do? Should we always show that this is not the case? There are countries that don't have data to do that. So what do we do? In terms of health effects, and this is a very difficult area, and industry and people who are against the taxes say, you're not showing anything. You're not showing that there are improvements in health. So can we expect big changes in health? How large taxes should be to observe these changes? A lot of countries have lack of data and capacities to accept the impact, and then the opposition comes and very strong because the objective is to reduce obesity, and we are not able to show that we did. And I think we can always say that taxes are just one tool, and that there are other policies that need to be implemented, front of pack labeling, school restrictions to food that is not recommended, a little bit like Chile, right? I think it's a comprehensive set of interventions that then we can think, and even in Chile, they are not thinking that the obesity distribution will move, but maybe they can prevent some new cases of obesity, maybe among children. So I think this is an important topic. And now about the models. I think models are adequate tools to assess medium and long-term outcomes that you cannot assess otherwise. You can include uncertainty. It's key if you don't have data to conduct any empirical analysis, any econometric analysis. But models have challenges. One is that they have a lot of different assumptions, and one needs to assess the impact of these assumptions. they are difficult to explain to decision makers, for example, and some are very complex. It depends on the model. And what worries me always is that in the world, there are so many different models, different assumptions. How can we compare them? Can we have one single model? And so we all agree that that's a dream, I guess. But the problem is that how many people trust on models, because every model could lead to different results. So this is something that I think we need to discuss. And finally, again, we have so many different type of taxes in the world, and the tier taxes are made to incentivize reformulation, which is great. But then I wonder if we can disentangle how much changes are driven by reformulation or consumer behavior. You know, how much of the response is only reformulation or consumer behavior changes? So do people continue to drink their preferred beverage and they pay more, but beverages have less sugar content and that's a benefit? Or do they reduce consumption, but they are loyal to a brand? Or do people switch to cheaper options? And how does a tier tax change the behavior? How can we do something more profound, so to move people, not just to move sugar content from the industry? And okay, so these are my questions, my remarks related to your presentation, Richard.
Excellent. Thank you very much, Arantxa. Let us now move on to paper 2 and second presenter. And we have actually Juan Carlos is going to be with us for two papers. So we have Juan Carlos Salgado Hernandez, who's a health economist, also a colleague of Mexico's INSP, and has been working in particular on SSB tax, both the consumer responses as well as a very importantly firm response. So Jesse, the floor is yours, and your first paper is on simulating international tax designs on SSBs in Mexico. The Zoom is yours.
Hi, everyone. So I'm going to present a summary of my study. I'm going to share my screen. Please give me 1 second. Can you see my screen? Sorry. Okay. Okay. Well, today I'm going to briefly present the results of our study, in which we simulate different taxes in the Mexican setting. So I want to start my presentation saying, like, in order to address the high prevalence of overweight and obesity in Mexico, in January 2015, a volumetric tax came into effect. This was a 1 Mexican peso per liter of sugar sweetened beverages for any beverage with added sugar. That implies, like, it doesn't matter the sugar content, the rate is going to be the same, and it's going to be linked to the volume. And in this case, 1 Mexican peso per liter. So far, the tax has been shown to be effective in increasing increasing prices of SSB and reducing their purchases. However, and related to the experience in UK, it is unknown whether a sugar density tax could be more effective in Mexico compared to the volumetric tax. The idea for sugar density taxes, it is like they target the risk factor linked to SSB, that it is sugar content. The higher the sugar content, the higher the tax burden. Because of that, it is expected that these sugar density taxes are going to generate larger health benefits compared to volumetric taxes. Another benefit of the sugar density taxes, it is they encourage reformulation across producers in order to reduce the tax burden to which taxes are subject to. So in a specific, the aim of this study, it is to simulate the effect in Mexico for different tax designs. Our baseline tax is going to be the volumetric Mexican tax, the 1 Mexican peso tax in effect since 2014. And we are going to compare the performance by this volumetric tax compared to the multi-tier sugar density taxes in the United Kingdom, that it has 3 different tiers. And also we are going to test we are going to simulate the effect in Mexico for a sugary tax equivalent to the one in South Africa, that it is a threshold linear sugar density tax. Moreover, we are going to account for the potential effect of reformulation by producers as a response to sugar density taxes. To achieve these aims, we are going to use a structural model of demand and supply that accounts for the simultaneous and strategic response by producers and consumers in face of the tax implementation. So the demand model that we use is different to the one just explained by Richard. In this case, we use a logit demand model with random coefficients in which people have preferences on products attributes such as sugar that it is relevant for this study. So what we found it is like for the case of the 1 Mexican peso tax and taxes equivalent to the UK and South Africa in Mexico, so we found a reduction in volume and in sugar by around 19%. It was basically a 1-1-2 relationship in which the sugar reduction was equivalent to the reduction in volume. When there is reformulation for the case of sugar density taxes in Mexico equivalent to the taxes in UK and South Africa, we found also a reduction in volume, but that reduction in volume was lower than the reduction in sugar. The reduction in sugar could be up to a reduction by 40%. So moreover, we also assess these reductions are also a result of the tax effect on prices, and in general, we found that the taxes are overshifted to prices. That implies like the price increase is larger than the tax amount. Moreover, we also found that the largest tax revenue, it was for the case of the 1 Mexican peso tax. This is relevant because we found when there is reformulation, because after the reformulation, there was a decrease in the tax burden, also is expected a decrease in the tax revenue. So that the largest tax revenue, it was under the current 1 Mexican peso tax. So that the success of the tax result will depend on the goal by the policymakers. If it is to maximize the tax revenue, that it is money available for the government, or if it is to maximize the sugar reduction, and because of that, long-term health outcomes. Well, thank you so much for your attention.
Super. Thanks so much, Jesse, and thank you for being super efficient on your comments, on your succinct summary of your presentation. Now we're going to have Nick Stacy to give some remarks on this paper. So Nick is a PhD candidate at the London School of Economics, and is also a researcher at the Center for Health Economics and Decision Science at Wits University in Johannesburg. And Nick has done extensive research in multiple aspects on SSB taxes in South Africa. So Nick, off to you.
Great. Hi, everyone. So thanks, Stefan, and thanks, JC, for this very interesting paper. So I have just sort of a couple of, I'll sort of review it, and then I have a couple of thoughts about the work. I think the paper's at a sort of advanced stage, so the comments might be more for sort of future avenues that sort of use this sort of approach. So the sort of backdrop for this paper is obviously the sort of growing interest in the use of SSB taxes to address obesity and sort of diet-related disease burdens. But the sort of emphasis here is very much obviously on tax design. And so there's a sort of, a lot of experience in the use of excise taxes on sort of tobacco and alcohol. And there's sort of all sorts of best practices for the design of those sorts of taxes. But as the sort of, use of excise taxes on SSBs is sort of a newer phenomena, we have some sort of ideas that sugar-based taxes are a good idea, but there aren't those sorts of best practices that you would have for tobacco and alcohol. And I think part of this is also driven by the fact that SSBs are sort of a kind of complex and diverse set of products, and a bit of a sort of moving target, I think, as like Arantxa sort of pointed out already in her comments. So there's sort of a couple of dimensions of sort of need for guidance on the design of SSB taxes. So the first thing is to sort of define the base of the products, and that sort of includes thinking about which particular beverage types are considered, whether you're interested in a sort of ad valorem or specific tax. If you're going to do a specific tax, should you do it by volume or by sugar content, and then what the rate should be. And so there is this sort of recommendation that came out of a WHO consultation on fiscal policies for health that sort of recommends the use of sugar-based taxes. But there's sort of many ways to do this. And so the UK has sort of adopted a tiered approach where there's a sort of fixed rate per volume, but that changes by the underlying sugar content. And then in sort of South Africa, we have a sort of more linear style design with a sort of initial exemption. But either way, there's sort of this need to understand like what the sort of differing effects of these types of different types of tax designs are. So this paper uses sort of borrows from the industrial organization literature and fits a sort of structural model to simulate the effects of various tax designs. Like JC has sort of already discussed, there's on the demand side, there's a sort of random coefficients logit model, and then on the supply side, there's like a differentiated product oligopoly Nash-Bertrand competition model. And so what the authors find are sort of significant reductions in sugar and volume in the UK and South Africa designs, these being greater than the volume design, sort of mimicking the Mexico policy, but greater revenue under the Mexico design. All right, so I think like a real strength of this paper is that it can really sort of speak to this issue of sort of differing effects of different tax designs. So there's, as countries are implementing these policies with sort of differing designs, we have these sort of observational papers which sort of look at trends in purchases. So these are sort of important in their own sort of context, but they don't tell us that much about, what effects of different designs would be in a particular context, because each country adopts its own policy. There are all sorts of differences which go, across countries. So, it's hard to draw inferences about, sort of optimality of these different types of designs solely based on the observational literature. And so the sort of simulation approach that JC has used here, I think really its sort of significant strength is that it's able to sort of get at sort of differing effects of different designs in one particular context. So something which is obviously very important with the sugar-based designs is this the need to consider reformulation. And so, in both of the sort of sugar-based policy scenarios that are simulated, in both settings, like reformulation was very much an explicit goal of the policy. And in the modeling that the authors do, there isn't the sort of kind of exogenous reformulation scenarios are modeled. And in some ways, these, I think, don't necessarily mimic, the sort of real world decisions that like firms are facing. And so, I think in practice, firms are sort of facing this trade-off between, increasing prices or decreasing sugar content. And it's kind of a kind of joint decision that they need to consider. And so I think, a way that this sort of area for development in terms of this type of modeling exercise is to think about how to jointly model the firm's decisions over sugar content and price changes. Another thing, I think, another sort of complexity which isn't necessarily captured in this paper is sort of within firm heterogeneity in responses to SSB taxes. So In the context of South Africa, where I've worked a bit on these issues, when we look at sort of price responses to the introduction of the policy, and also to some extent sugar reformulation, even within firms, we find like quite, if you look across the brands within a given firm, you can find like quite different responses. And so I think the fact that, the sort of beverage companies in these settings are generally sort of large multi-product firms who sort of, approach these policies thinking about their whole portfolio rather than like each brand individually, I think needs to be considered in some way. So JC can correct or comment on this, but my reading of the paper was that it does sort of model the firms as multi-product firms. But then in terms of the results that are reported, these are sort of aggregated up sort of across all brands, or are reported for the sort of lead firm as a whole. Yeah, so I think that's a sort of complexity that that is sort of worth considering. And then I think the last comment I wanted to make was that I think there's one of the, I think, considerations with any sort of SSB tax policy are sort of potential regressivity of the policy. And, so I think traditionally how this is sort of talked about is that, SSB taxes may be sort of progressive for health because of sort of differing price sensitivities. But there's sort of another dimension to this, which is the sort of distribution of the types of beverages by income and the sort of sugar content of those beverages by income. And so if you introduce a sort of sugar-based tax, depending on what the sort of distribution of beverage sugar is by income, this potentially again kind of adds sort of complexity to these sort of inferences about distributional incidence. And so I think another sort of dimension for where this sort of work could be taken forward is to think about distributional incidence of sort of differing tax policy designs, and thinking about sort of how to stratify the sort of demand side of the model in some way to try and simulate sort of distributional incidence issues. Right, but in closing, I think this is a really sort of great paper. Sort of applies methods from industrial organization to address, I think, what is like a really sort of significant issue in the sort of SSB tax world, which is the sort of need for some sort of normative guidance about that sort of evidence-based for the design of SSB taxes. That's all I've got.
Great. Thanks. Thanks indeed. Thanks a lot, Nick. Great. So now we move to paper 3, succinct summary, and we welcome back Jesse. Go back on stage.
Hi again. So I'm going to share my screen to present the summary of.
Maybe talking about cost-benefit analysis in Mexico.
Can you see my screen? Yes. Okay. Wait 1 second, please.
Do you want to make it full screen?
Yeah,
great.
It is. Okay, so for this summary of study, so we conducted a cost-benefit analysis of the current tax in Mexico and also some other tax levels. So specifically, there is evidence that has shown that the current SSB tax in Mexico, it is cost-effective. However, there is no study assessing the cost-benefit of the tax. Specifically, there is no evidence of the net benefit of the current 1 Mexican peso tax per liter of sugar sweetened beverages in Mexico. In this context, the idea of the net benefit, it is the difference between benefits and cost. So for cost, we have the reductions in profits across producers, basically because there is a reduction in purchases. And also we have a reduction in consumer welfare. Specifically, this corresponds to the consumer surplus to which we can assign a monetary value. The idea it is the reduction in consumer surplus, it is because consumers reduce the consumption of a good that they value, SSB, or they are paying higher prices for that good. And the benefits, meanwhile, is the tax revenue from the tax collected by the government, and also health savings associated with the long-term improvements in health at the population level. In this study, estimates of reductions in profit, reduction in consumer surplus, and tax revenue come from the structural model that we just previously explained. Meanwhile, the estimates of the health savings come from an EP model in which the main input in terms of the reduction in purchases also came from the structural model. So specifically, the aim of this study is to estimate the net benefit for the current One Mexico tax, an alternative tax that is a tax of 2 Mexican pesos per liter of SSB. We chose this level because that's the recommended level across public health experts in Mexico. Moreover, we also tried like some low and high values. That the lowest one, it is 0.5 Mexican pesos per liter of SSB and 3 Mexican pesos per liter of SSB. Now I'm going to present the results of our study. This is the net benefit in which this area represents a situation in which costs are larger than the benefits. Here, benefits are larger than the costs, and this is the break-even point, and this is the years after the tax implementation. I start with the case of the lowest level of the tax, that it is 0.5 Mexican pesos, in which the break-even point it is achieved like around 8 years after the tax implementation, and then afterwards there is a positive net benefit. This is the case for the 1 Mexican peso tax, in which the break-even point is achieved. It takes longer to achieve the break-even point. It is around 10 years. And after that, we see also net benefits, and those are larger compared to a lower tax amount. Then we have the recommended level that it is 2 Mexican pesos. The break-even point it is achieved around 12 years after the tax implementation. And afterwards, we have net benefits, positive net benefit. And finally, we have the highest level that we test in the study, that is a 3 Mexican pesos, a 3 Mexican peso tax. The break-even point is achieved after 16 years of the tax implementation, and well, afterwards, as for the other tax design, we have positive net benefits. However, it's important to highlight, like, the increase in the net benefits is proportionally lower than the increase in the tax amount, that it is equivalent to say that it has a diminishing rate of growth. So the conclusions of our study, we saw like regardless of the tax design, all of them are predicted to generate positive net benefits. However, those net benefits depend on the time horizon of interest. We saw like the increase in the next benefit is proportionally lower than increasing in the amount of the tax. Moreover, we also saw a similar performance in terms of net benefits when we compare the 2 Mexican peso tax versus the 3 Mexican peso tax. This is relevant because of discussions in Mexico about increasing by twice the current amount of the tax. Okay, thank you so much for your attention.
Excellent. Thank you very much, Jesse, for this very good summary. So now I'm going to invite Akshar Saxena to give some comments and remark. Akshar is an assistant professor of economics at the Nanyang Technological University in Singapore, and his work spanned multiple areas of health economics, public economics, fiscal policies, and healthcare financing, broadly speaking. Akshar, the floor is yours.
Thank you, Stefan, for having me. Thank you, JC, for excellent summary. And thank you, Nick, for helping me with doing a full summary of the SSV field. So it helps me with the entire presentation. So let me dive straight into the paper. As JC had said, the paper presents estimates of costs and benefits. I would not go with the cost benefit analysis, but I would say costs and benefits due to an excise tax. And what they have done is they have basically started with a basic disease model, which most of the other papers have used. So they use excise tax with changes in consumption. That's important because we will measure the changes in welfare, the producer and consumer surplus, and changes in tax revenue due to that consumption. And the changes in consumption lead to changes in BMI. That's the main model through which they are modeling the disease burden, leads to changes in diseases. and they have certain diseases that they have modeled, mostly diabetes, IHT, stroke, a few cancers, and osteoarthritis. And they also measured changes in premature deaths. Now, the diseases and deaths lead to changes in public healthcare costs. And so those are the green ones are the benefits, and the red ones are all the costs. Now, what's interesting about this paper is that in this increasing field, quite a number of studies have just focused on the yellow parts or the disease incidence modeling, and they have linked themselves to public healthcare costs or to the cost savings or to the revenue systems. But this paper goes beyond that thing and calculates certain other elements, such as the disability pension or the changes in retirement pension, which have not been dealt with in the literature. So that's innovation in this paper. They have also looked at the consumer and producer surplus, changes in consumer and producer surplus. So they are adding a few elements of additional costs and benefits to this whole field. And what other thing they have done is they have actually done it with different time spans. So they have taken a time span of 10 years, 35 years, and a longer time span of lifetime. So they can model exactly how the pension costs come into play once these people who have avoided the disease become old. Now, this is a very interesting field because in the field of smoking, this was a very common joke that why should we stop people from smoking? If we let people smoke and let them die, then they actually pay taxes to us at the moment. They pay smoking taxes and they pay income taxes, but they do not have any pension entitlement. So it's a good policy to let people smoke. That used to be a joke in the smoking literature. And these people have brought that element to the sugar tax element. Should we tax the sugar and should we have the later pension costs and disability pension costs modeled in? So I find that paper very interesting with that element. Now, there was a certain issue with the costs and benefits. In a traditional cost benefit analysis, there are certain ways of looking at different perspectives. You look at the individual perspective in which these people have looked at the consumer surplus. Then they moved on to the business perspective, looking at the producer surplus. Then within the government sector, they have computed the healthcare costs, disability pensions, retirement pensions. They've also included paid sick days and the tax revenue earned by the government, but not the tax revenue or the tax transfer that happens from the individuals. And interestingly, on the society, they have looked at caregiver savings as to if these people are not sick and how much is the caregiver savings happening for those. Now let's look at the results. As JC had just presented, they show us the net benefit. It becomes the break even is at 16 years of tax implementation. This was from the paper. And at different tax amounts, you just scale the results differently. So this is the basic paper. Now I'll get into some of the comments as to how this could be. There's certain challenges with this modeling because I've done the same modeling earlier. So I would share some of the challenges and pitfalls here. So I would focus on the epidemiological model, cost and benefit model, and lastly, the components deriving the results. So in the disease pathways, I think the major component is, or the major question that always gets asked is, how does BMI affect the chosen conditions? So the authors or JC have chosen a few conditions, and there's always a question as to why these conditions and why not some others. Now, in my own work, what happens is whenever I talk to the governments are certainly interested in one or the other conditions of which they feel that they should be making an impact. And most of the time, the funders or the governments affect the policy choice. So I think it would be interesting if JC could elaborate in the paper as to why they chose certain conditions, especially for cancers. They chose breast, colon, and kidney cancers, but there's also very strong evidence on, let's say, liver cancer and actually a higher evidence than the other three cancers on the impact on liver cancer. So why was this cancer chosen and why the others were not? And the other crucial part about sugar modeling is that as the literature evolves, as the disease models evolve, the question comes in, is the effect of sugar only through BMI, or is there effect of sugar happening through other channels as well? So there's a very interesting paper in Imamura a bit now 6 years ago. They brought up the literature of how differently the sugar could model different diseases. And I think it would be a good reference point to bring in that paper to say there could be other models, and hence the estimates that are in this paper and the previous paper could be likely the lower bound or the underestimate of the total avoided incidence and mortality. So some portions on the epidemiological pathways. The second part about the epidemiological model is we need to look at the baseline incidence and mortality in the country itself. So with the baseline GBD mortality, IHT was about 14% and stroke 5% and diabetes 10%. But if you look at the model's results, the estimates, diabetes has a 10:1 ratio with IHT and stroke, whereas in the baseline GBT mortality, that ratio does not exist. So for the 10-year mark, 1:10 is the avoided incidence. Once you move to the 35-year model, it becomes 1:7, 1:7.5. That means the burden is shifting to IHT, even though in absolute numbers, diabetes is more, but the burden on IHT and stroke is kind of increasing. If you look at the mortality incidence, that's the mortality or the avoided mortality, that's even more interesting. At the 10-year mark, IHT and stroke have a higher avoided mortality. But at the 35-year mark, the ratio is 1.6:1. So again, the burden is shifting, the proportions are shifting. So you do see higher diabetes mortality avoided, but the proportion between IHT and diabetes has shifted. Now, why is that important? The importance comes in because you're looking at a very long time span from 10 years to all the way to lifetime. Now, in incidence, diabetes has a very low initial cost. When it gets detected, it could be managed at primary care, but what we see is within 10 years, when people get leg amputation or people get gangrene, the cost escalates. So there's a very high later cost. For stroke, what we observe is a different way, where there's a very high initial hospitalization cost, and then it's managed at primary care. So when you're looking at a 10-year perspective, 35-year perspective, and a 75-year perspective, it's very essential to model how your incidence is evolving over time, how your mortality is evolving over time, and what's the cost associated with different stages of healthcare over time. So I think they have to bring in this element, or if it's already been modeled, I think it'd be good to state it in the appendix as to how they have modeled it very differently. Now, coming to the cost benefit versus costs and benefits models, I think I'm an economist who take things rather loosely in terms of definition, but there would be certain faction of academics who take the cost benefit analysis in very pedantic terms as to what should be included in cost benefit analysis. And they definitely include different perspectives. So for example, when you're looking at the individual perspective, why were the private healthcare costs not included? Or why are they included? So it would demand a discussion of the Mexican healthcare system as to, is the entire healthcare system being paid by the government? Then there would be no individual healthcare costs. Secondly, would be the healthcare sector. Are the profits and expenses for the hospital sector included or not included? So again, within the US, there's a huge literature which talks about the non-profit healthcare sector. Every textbook talks about it, and it would be good to have a certain discussion of how the hospital sector operates in the Mexican context as well. And
Akshay,
finally,
Akshay, sorry to interrupt. Can you wrap up in 1 minute?
Sure, I'll be done in 1 minute. Yep. Lastly,
Okay.
the government, whether the tax revenues or the transfers are actually part of the costs and benefits. So that's the last bit. The very last bit is the components. So although you have a chart which shows the net benefits and costs, and you show that it's 16, I think what would be interesting to the policymakers is actually what is the main component that's driving these results. So if you could break it down into different components of your net costs and benefits and show where the main effect is coming from, I think that would be really helpful to the policymakers. So main contributions of the paper, it does costs and benefits, and it has assessment based on post-implementation data, and they do have a longer time span. And just the main comments were on epidemiology, the cost benefits, and the main components. So thanks again for this great paper, and looking forward to reading the final paper.
Excellent. Thanks a lot, Akshay. So now let's open it for questions. So if you have a question, please, I think the easiest would be raise your hand and ask a question directly to one of the speakers or all of them. Looking around, I don't see, yes, Fabrice, and then Dominic. Fabrice, please.
Yes, thank you, Stefan. I have a question for Richard. I wonder whether in his general equilibrium model, if you are able to account for the fact that firms have managed a portfolio. And the point was also about the presentation of Juan Carlos. So the firms manage a portfolio, and so they may have strategic considerations in terms of response to the tax.
Okay, great. Dominique, do you want to ask your question? And then we'll ask the presenters to respond.
Sure, yeah. My question is about the consumer surplus measure and whether it assumes constant tastes over the future horizon. So like at the time of implementing the tax, consumers suffer from having to pay more for a good they value, but you can imagine that in 10 years from now, they might not miss it. They got used to lower sugar beverages, so they don't experience that loss so severely, or new people have grown up under a different kind of drink regimen. So that element of consumer surplus might decay over time, conceivably. I wondered if you tried addressing that at all.
Great. So Jesse, do you want to give a few answers?
I think the first one was for Richard. So
yeah, no, sorry. And
oh yeah,
Richard.
yeah. Okay, so I can go first. For Dominic, yeah, for consumer surplus, we assume that it remains constant over time. So in that sense, this is a conservative assumption. And yeah, also we didn't have enough time to discuss this, but the measure comes from a model in which consumers only value products attributes. And in that sense, there is a limitation because probably also people are going to value improvements in health associated with the improvements at the population level. So, and also related to what Akshar presented, for those are preliminary results. We also want to try the value of statistical of life. That is also related to the consumer surplus, in which it is how much people value to keep living because of the tax implementation. Thank you.
Okay. Richard?
Yeah, I think slightly provocative answer maybe. So I'm going to suggest we know more about what consumers will do than we do producers. So that we, certainly in the UK, we've built our models on a lot of econometric evidence going back a long way, using data that's at household level for 36,000 households. We know a lot about, if a price changes, what does a consumer do with the products that are available. What we don't know is, if you intervene, what does the industry do to change the set of products available? And I think that's the real kicker for us trying to model this going forwards. Actually, is it's not a price change that's the issue. It's what industry is doing around the price change that's really difficult to grab hold of and take forward.
Great. See, Fabrice, I think, is that a leftover, your hand up? Or you still have a follow-up question?
No, sorry. I just let my
no worries. It's a Zoom artifact.
But
so
just answer to, yeah, okay.
Please.
No, just answer to Richard for the UK sugar levy tax. We start having some evidence about firms' reactions in terms of innovation, etc. There are data, there are the Mintel data sets, etc. that you may use. So
great. Thanks, Fabrice. One question for me. I know we're reaching past the hour. I believe we can stick around for a few more minutes afterwards, but we're not going to stay forever. I just had an overall question, since I don't see any hands up, which is about design and equity. Several of you, UK, Mexico, also in the South Africa, experience that Nick had, I've mentioned, in different contexts, but different products, taxing different products that would have people from different socioeconomic groups consume different products. So maybe some just high-level remarks or thoughts, insights about tax design in terms of variety of products and the equity implications, where your intuition might lead you. So perhaps Richard and then Jesse. So Richard?
So I think that's one of the interesting points here, because the equity argument is, you're going to affect the poor disproportionately more with a price increase, because in a sense they're disproportionately their expenditure on these products, but of course they share a disproportionate burden of the disease. So in some ways your equity can cancel out, if you want to look at it that way. I suppose the argument around the UK one is, can you actually achieve both goals, in the sense of you've not impacted on their income equality issue. So you've not made what they're consuming any more expensive. What you have done is make it healthier. Now, there's a bit of a big question there about whether artificially sweetened drinks are healthier than natural sugar sweetened drinks. And there's a bit of a jury out on that. But I think that's quite an interesting take on it, is to say, actually, we're not trying to affect what people are buying. We want to make what they're buying better for them going forwards, or less bad for them going forwards. because you can have a similar argument about, and we've had that a little bit in the UK, about size, about by stealth reducing, for example, the size of chocolate bars. So you're not trying to persuade people to stop eating chocolate, because I'm not going to, frankly. What you do is you try to just reduce the amount they're eating. And that gets us into this bit of, behavioral economics and nudge language and stuff, which we can talk about. But I think it's really fascinating as to whether that's really happening, which I suppose is what we are doing in our observational studies in the SDIL project, is trying to say, does this seem to actually be happening? Because if it does, it could be a very interesting approach.
Thanks, Richard. Jesse,
Sure.
some thoughts?
So for Mexico, previous evidence also shows like there was a largest reduction in SSB purchases by low-income households, and we found similar results. We found like the higher the income, the lower the price sensitivity, and probably the lower the reduction income. Well, then I don't know about the reduction in consumer surplus, but my point it's something that we need to explore. Like if the reduction in consumer surplus that it is part of the welfare analysis, it was different by income at the household level. And also we can assess this part related to differential changes in SSB purchases by income level. And probably we can translate that and we should translate that for the EP model to see also differential analysis, because also in Mexico, in general, it has been seen that the financial burden is proportionally higher for low-income households. So that if they experience a higher improvement in health, probably those welfare effects related to health effects probably are going to compensate the reductions in welfare related to the reduction in the consumption of the value good, in this case SSB. But this is something that we need to analyze. Thank you.
Great, thanks, Jesse. I think it's probably time to wrap up. So thanks very much again to both our presenters and discussants for a very rich, slightly too short discussion. And again, all the full papers are available online. There's live recordings, and please, if you have any further questions, please feel free to follow up with each of the presenters and discussants. Thank you very much.